Ankylosing spondylitis and physical therapy management of ankylosing spondylitis. Ankylosing spondylitis. It is a rheumatic disorder that results in eventual ossification of both the anterior and posterior longitudinal ligament and the facet joints. The term ankylosing spondylitis is derived from two words. The first one is ankylosis, which means fused bones or other hard tissues, and spondylitis, which means inflammation in spinal bones or the vertebrae. The clinical features of ankylosing spondylitis. Ankylosing spondylitis first appears in adolescence and peaks in mid-20s. People with this pathology complains of pain at the bilateral sacroiliac joint, thoracic or lumbar spine, shoulders or foot regions. Now, symptoms of ankylosing spondylitis. Stiffness and pain in the lower back, buttocks and hips upon waking up in the morning or after a period of inactivity. Back pain relieved by movement and exercise. Difficulty in bending the spine. Pain in hips and difficulty in walking. Pain in heels and soles of feet. Pain in jaw, the temporomandibular joint. Bent over posture. Straightening in normal curvature of spine. Loss of appetite. Weight loss. Fatigue. Eye swelling, redness and pain, sensitivity to light, difficulty in taking deep breath because expanding the chest is difficult and painful. Heart failure, heart block, that is, problems with the flow of electrical impulses that control your heart muscles, bowel inflammation like Crohn's disease and ulcerative colitis. Next, causes. The incidence of ankylosing spondylitis is tied to your genes. Most people with ankylosing spondylitis have genes that make a protein called HLA-B27. It commands your immune system to attack some common bacteria in your body and sets off ankylosing spondylitis symptoms. Risk factors. There are two major risk factors for ankylosing spondylitis. Number one is sex and the second one is age. Sex. Men are more likely than women to have ankylosing spondylitis and it strikes them earlier and harder. Women tend to have a milder form of ankylosing spondylitis called non-radiographic axial spondyloarthritis. Age often starts in your teen and young adulthood as described earlier in the definition. Complications of ankylosing spondylitis. There are three areas of complications: the spine, eyes, and heart. Spine. The vertebrae may become weak, making them more likely to fracture or break. Damaged vertebrae can irritate nerves, and one may have trouble in controlling bowels or bladder. Eyes. About 80% of people with ankylosing spondylitis have an eye problem called uveitis. The heart. Ankylosing spondylitis can enlarge your aorta, allowing blood to leak back into your heart. The physical therapy management. Number 1. To relieve pain. We can apply hot packs, shortwave diathermy, TENS, and progressive relaxation techniques to relieve pain. Number 2. To reduce spasm, we can use hydrocollateral packs, ultrasounds, sustained passive stretching techniques of quadriceps, sacrospinalis, neck and spine muscles, and hydrotherapy. Number 3. To improve spinal mobility, flexion, extension, and rotational exercises of spine, continuous or intermittent traction to widen intervertebral spaces, medicine ball exercises, reaching activities in sitting and standing, spinal mobilization techniques. Number 4. Use of splints. Hip, knee, ankle, foot orthosis, ankle knee orthosis, knee ankle foot orthosis can be used to prevent hip and knee flexion deformity. Spinal casts or frames, soft cervical collars to prevent cervical flexion deformity, butterfly pillow to support neck, and lumbar corsets can be helpful. Number 5. Postural correction and ergonomics. Visual and biofeedback. Avoid stooping posture. Sleep on a firm mattress. Number 6. Chest physical therapy. Deep breathing exercises to improve the vital capacity. Incentive spirometry. Pursed lip breathing to prevent dyspnea. Coughing and huffing technique. Chest mobility exercises. Number 7. Strengthening exercises. Progressive resistive exercises, pulleys, weight, dumbbells, spring resistance tubes, spine, hip, and knee joint are mainly concentrated in strengthening exercises. Number 8. Functional training. Teaching the activities of daily living, gait training, swimming, aerobic exercises, and recreational exercises. Medications. NSAIDs and DMARDs can help in reducing the severity of symptoms, but their overdose may lead to GI bleeding. Surgery. There are two major types of surgeries performed in ankylosing spondylitis. Number 1 is laminectomy and number 2 is hip replacement surgery. Lifestyle changes. Being active, eat a healthy diet, and quit smoking.